the Evergreen Media Network Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
No one told me that.
No one told me that.
No one told me that. In pregnancy highs and lows,
We are tackling the I didn't knows
it's the No One Told Me podcast
with Janay
and Tay. Hi, everyone. Welcome to the second episode of the No One Told Me podcast with
Janay
and Tay. We are really excited to jump into our conversation today. I feel like now we're in the second episode. We can start diving into some of these conversations we've been planning and talking about. So excited to get into that. But before we do, we have some exciting news, Janay. Janay, what happened recently that you want to share with everyone?
I don't know, maybe they've noticed that my name changed along the screen.
Yes, so Miss Janay got married. Let's flaunt your ring, you know? Yeah. I love it. I love it so much. And I mean, I know the story, but I'm sure everyone wants to know, like, how did you meet and what's his name?
Okay, so DJ and I, we went to school together. We had honors math, and so we were like little geeks. We were both like so funny, full of life. So yeah, I've known him since high school, and we was just like really cool friends.
Yeah.
And then when I went off to college, I was at FIU. He was at FAU, but he was best friends with one of my good relatives.
Mm-hmm.
And so I used to go hang out with them all the time. It was never anything like that. And then we had this ongoing joke about I killed his fish and I was trying to bury it. And so I just called him one day. I know I had him call me one day and I was like,
fish.
Yeah, I don't even know what type of fish it was.
Okay.
Yeah,
That's a story for another time.
I didn't really kill a fish. And so I reached out to him and I was like, hey, call me. I need a good laugh. And we've been talking consecutively, like every day, consistently.
Wow.
Yeah.
Well, and then obviously you
now
you have to talk
married.
every day because
Yeah.
you're married to him. So
so
well, that's exciting. Well,
Yeah,
we're also excited for, the future, when you have some other more beautiful babies. So
let's not rush that.
well, very good. Well, today we have Angela Love, midwife and owner of Midwife Love in Vero Beach, Florida. And we're just really excited to have her on and to hear her wisdom and, actually just learn more stuff about alternative birth methods and midwifery. So Angela Love has been attending births since 1999. She's worked for 5 years as a registered nurse in several Miami hospitals and labor and delivery units. And while she became competent at handling many high risks and complex births, Angela graduated from the University of Miami in 2004 and began working at a busy birthing center in Miami, Florida. She loved the freedom women had during birth to do what felt best for them. In 2019, Angela moved to Vero Beach, Florida to be close to family and started a home birth practice, Midwife Love. Angela is happy to be on the Treasure Coast, enjoying the beautiful nature here and providing the option of water birth, home birth, and gentle gynecology. In 2010, Angela realized her dream of becoming a mother. She learned firsthand how amazing warm water feels during labor and how important freedom and movement is during birth and how valuable good labor support is. She had her second baby, Zoe, in 2014. Her daughter, Zoe, was born at home with a local midwife, and Zoe weighed 10 pounds, 10 ounces with only 2.5 hours in labor. Wow. Well, thank you, Angela. We're so excited to have you here. Thank you for coming on and sharing that. 2.5 hours for 10 pounds and 10 ounces. That's impressive.
Yeah.
That's really cool.
She came out like a rocket.
Oh my God, I can only imagine.
I know, I can't imagine either. Well, could you explain like why moms choose home birth or other alternative birth methods, so a birthing center?
Yeah. So some moms choose community birth, home birth or birth center because that's what's normal in their family. Mm-hmm. Their moms, their sisters, they could have all given birth there.
Yeah.
That's really beautiful when that happens because maybe they were even present at their mom's birth. And from a young age, they didn't have a lot of fear about birth.
Yeah.
They saw it as a normal family event.
Yeah.
So that's always nice. Some people choose home birth because they've done a lot of research and they really want a natural birth. and they know that it's going to be easier if they're with providers whose values align with theirs, and they have a lot more freedom and movement and a lot more patient providers. And then some people do choose community birth because they've had a traumatic experience in the hospital, or maybe didn't get the things that they wanted. And so they choose community birth for their second, third, or whatever number birth it is.
Yeah. I love that we're learning about this community birth before we got started here. You know, we were saying, you know, home birth and birth center, but really you were saying that those two can kind of be lump summed into community birth. So that's a really cool thing to take away.
So we're curious to know. So I'm just going to give you a little backstory first before I ask my question. So I want to know, how do you go about getting a midwife? Because with my second pregnancy, I was very curious and I thought that I wanted a midwife. I thought that was an option that I could take. So in my head, I was like, okay, I'm just going to go to all my OB appointments. And then when it's time to deliver, like literally, I was like, I'm just going to deliver at home. I was like, I didn't really know how that went. So I was like, okay, so you just go to your OB. And I didn't know that the midwife was like your OB and she does your prenatal care and all that. So could you just explain to the listeners the process and how it goes?
So midwives do all prenatal care, birth, postpartum care. Nurse midwives like myself, we also do gynecology and well women. So some women who even never have babies, they find a midwife. Midwife work in all places. So there are midwife practices that just do hospital births. There's one in Melbourne called Hibiscus. And there are home birth midwives. There are birth center birth midwives. So the home birth midwives are probably the hardest to get because they have a quota. Most of them that have good boundaries have a quota saying, oh, I can take this many of people before I lose my mind. And so they have their number, and then when they fill up, they're full and they have a waiting list. Birth centers can handle more capacity. Most birth centers will have 2 or 3 laboring rooms. And so some birth centers can do 30, 40 births a month because the women are at the same place. With home birth, it's harder because you can only be in one home at a time. So that's the first thing at the beginning of the pregnancy. If you want a midwife thinking, am I thinking about home birth? Am I thinking about birth center? Do I want to birth in the hospital? And I know for home birth and birth center, most all of the midwives do free consults. And so if you qualify, if you don't have severe health issues, then you get a free hour with the midwife. And you can ask a million questions, feel out their philosophies and their experience, and see if that's a good fit for you. And you could interview 3 or 4 and then have your pick. They're all going to be slightly different. And it really depends on your area, because depending on where you live in the country, you may have no home birth midwives. Or you may have 5 in your city, or you may have 10 in your city. So some people have more options than others. We need a lot more midwives in this country. So anyone who's considering that as a career, go for it.
Yeah, that's awesome.
Now we know that you're a woman of many hats. So can you just explain to us a little bit more about what you do? Because I don't think you know, but she actually clipped Caleb's tongue for me.
Oh,
that was a very traumatic experience for me, because Drew, he had his tongue clipped, but it was in a hospital setting with Angie. We just went into her office and she just did everything right there.
Wow.
Yeah. So I've been a midwife now for 19 years, a long time. And some midwives do frenectomies or releasing of the tongue. I learned some techniques from my former boss, Sherry Daniels, giving her a shout out. And I learned some from my sister, who's a dentist.
Very cool.
And so, I've been doing frenectomies for most of the time because it sometimes really impacts nursing. And I try not to charge too much and try to get people in pretty quickly so that if I can help any babies remain nursing, I feel like that's one of my prime missions.
So that is a barrier with breastfeeding when you have that. Can you explain that a little bit more?
It can be. So not all tongue ties cause issues. But there's levels of severity. Sometimes people only pick up a tongue tie if it's all the way to the tip of the tongue, like a level 1 or level 2. But there can be a level 3 or even a level 4, which is posterior. It's hard to see, but if you really get under there, you can feel the restriction. So,
And that, yeah, how do you identify that necessarily? Like, I guess as a parent too, without a professional looking at it.
so if breastfeeding is going well, you probably don't need to worry about it.
Okay.
Yeah.
Okay.
If anyone is having painful nipples beyond the first week, they should get checked out.
Okay.
If anyone's having a trouble with milk supply or baby maintaining a latch, they should get their child evaluated.
Okay.
And they want to go to someone experienced in evaluating tongue ties because unfortunately not all providers are experienced. So if they want to come to me, great. If they want to go to a lactation consultant that has experience.
Sure.
Some pediatricians have experience with that. Other people that do frenectomies would be ENTs, dentists, and some pediatricians do as well.
Because that was
I learned
what
something new
happened with me. I had really painful nipples, and Linda was working very closely with me. And Caleb and I, we went into her office at WIC, and she was like, "This baby has a tongue tie." She was like, "Why don't you reach out to Angie to see if she can help you guys?" And I was like, "The midwife?"
See, I did not know this. How did I not know this?
Right.
Well, I learned something new today. That's really interesting.
Yeah, there's
Okay.
a big network around us.
Very
We need
cool.
a lot more people who do
I was gonna
frenectomies.
say, yeah.
I get referrals from WIC and lactation consultants for 3 counties
Okay.
that come
Wow.
to see me.
Wow.
And unfortunately, like the ENTs, a lot of people want to use their insurance and go through ENTs and stuff, but they might say, "Oh, we'll see you in 2 months
Right.
or a month."
Right.
And if you have cracked, scabby, bloody nipples,
That's not, you're not going to wait
you're going to give up on nursing. Is
Right.
what's going to happen.
Sure. Sure. That makes sense. Well, I wasn't always super educated around home birth until maybe about 4 years ago when I started thinking, okay, like, we don't want kids yet, but, when I do get pregnant, like, what does that look like? What do I, so I started doing some research, and at first home birth kind of scared me a little bit. I was like, what happens if something happens? And I think there's a stigma around home birth. Like, it's not safe. And as I started educating myself and looking at resources and just doing some research, I was like, wow, this sounds like a really empowering setting, something that, I would potentially be interested in. And then, I kind of followed that for about 2 years. And then I ended up starting at Healthy Start. So, and where it's very welcomed and, whatever the mom chooses, but just knowing the options was really empowering, I think, to me. So can you talk about, and statistically talk about why there's this stigma around home birth and people feel like it's unsafe? Like, what if something happens? These are all questions. Like, when I mention it to my friends, they're like, well, aren't you worried? Like, there's going to be emergency and they're not going to have the material. And I was like, well, when you talk to your midwife, you understand that they are pretty much equipped with almost everything that a hospital could provide. So can you talk a little bit about that?
Sure. Yeah, so home birth is safe for low-risk women that have experienced providers.
Yeah.
And the things that make it safe are monitoring. Mm-hmm. So in a home birth, we're monitoring the mom's vitals, make sure she's tolerating labor well. We're monitoring the baby's heartbeat with a Doppler that's waterproof. So even if she's in the tub or the shower, we can still listen to the baby. We use the same intermittent guidelines that ACOG and ACNM put out that say they're wonderful for low-risk women. Yeah. Okay. The equipment we have at a home birth, a lot of it we don't use, but we have just in case. Yeah. For example, most women do not need an IV to give birth, but if someone's vomiting a ton and needs to get rehydrated, we carry IVs. We have antibiotics, so if somebody has GBS, we can treat that. Okay. We have medications to stop hemorrhage, the same ones they have in the hospitals, including TXA. We have oxygen. We have resuscitation equipment for mom and baby. Home birth providers are trained in CPR and NRP, which is neonatal resuscitation. We have medications to numb and to stitch if somebody tears. I carry nitrous or laughing gas. So the things we're not doing at home, we're not doing epidurals. Okay. We're not doing C-sections. We're not doing blood transfusions. Yep. So if we needed one of those, we would go to the hospital. So the idea of home birth is not home birth at any cost. Yeah. The idea of home birth is home birth as long as it's safe. Right. My goals with home birth are to keep it safe, sacred, and sustainable.
I love that.
So sacred is really honoring of the family. Yeah. That this is more than a medical event. This is a family life event. Yeah. that your choices are valid, that we trust in your wisdom.
Yeah.
And keeping that autonomy with the family, and really respecting that time after birth as a bonding time.
Yeah.
You know?
That's beautiful. I love that.
And I think people kind of overlook the history of midwifery and how successful it's been up until now. Like before, I'm pretty sure they had like the hospital setting births. People were using midwives to birth their babies.
Yeah, so here in this country, birth moved into the hospitals somewhere between the 20s and the 40s. In the UK, they use midwives for everybody.
Yeah.
And so everybody gets a midwife in the UK. And then if you become high risk, then you see the high risk doctor, the OB.
Yeah.
And I love that model because no matter how you are, everyone deserves that one-on-one care, that continuity of care, that holistic care that midwives provide. And then they ask you at the beginning of your pregnancy, if you're low risk, do you want a home birth? Do you want a birth center? Do you want a hospital birth? Like everyone is given a choice. So here in America, we have a different mindset.
Right.
But in many countries in the world, they do home birth and they are integrated into the system pretty seamlessly.
Yeah. So what is the big differences between a home birth and a birthing center?
It's your home.
Yeah, well, right. That's a big one. It's in your home.
So I would say for people that have a comfortable home, home birth is the gold standard.
Right.
You feel the most comfortable in your space with your things, your microbiome, your germs.
Sure.
If you have other kids, they can be there.
Yeah.
So most people are going to labor the best if they have that nice, comfortable home. The birth center is way more convenient for the midwife.
Right.
She can have several people laboring at once. But it's not your home. It's a home-like environment. And some people don't have a comfortable home.
Sure.
Some people live with a ton of family that they want to escape.
Yeah, exactly. Yeah, that's a great option.
And so the birth center is good if you have that crowded home, or if you don't have a comfortable home and you want to go to some other place to birth. But equipment-wise, it's the same.
Gotcha. Okay.
So do you mind walking us through like the scene of like how a home birth, or if you go to a birthing center, how that plays out? Because we all know that if you go to the hospital setting, you know, you go in, you get admitted, you get hooked up immediately, you get all this blood work drawn and all this stuff. For instances like myself, like I have to get on magnesium and all types of other stuff. So how does it go like for a home birth?
Sure. So for a home birth, we pull up and the person's called us. They think they're in active labor. For the early part of labor where contractions aren't that strong, maybe they've called their doula if they have one. When things are getting more serious, they call the midwife. We get there. We have our suitcases. I have like 2 big suitcases I bring. It looks like I'm moving in. We get there, put the stuff down. I try to just take a moment and be quiet and listen and observe. How is this woman coping with labor? How are her contractions coming? Kind of like ease into her space.
Sure.
I don't need to ask her a million questions because I know her well.
Right.
I have her chart. There's no consents to sign. We've already done that. So we're not activating that part of your brain, that intellectual part of your brain that's immediately activated when you go to the hospital. You're able to stay in the flow of labor.
Right.
So if she's okay with it, I say, can I check your vitals? She could say yes. She could say, give me 5 minutes, you know? Whatever. I am going to respect what she says.
Right.
Is it okay if we listen to the baby? And we do that. All are well. So then I might go into the other room that she's not in so I don't bother her and arrange my equipment. I set it up on little trays, like cafeteria trays. That way, wherever she wants to birth, we can follow her around with those trays.
Very cool.
And so we do the intermittent monitoring. We're bringing her drinks, coconut water, Gatorade, water. If she wants to eat, she's eating. We're helping her get into different positions, in and out of the shower, in and out of the tub. If labor is slow, we might suggest different positions that we think are going to help baby to rotate and come down. She then wants to push. She pushes the baby out. If she or her husband want to catch the baby, we let them.
Right.
We're observing to make sure all is going well, but a lot of families do choose to catch their own baby. We do very few episiotomies. And then they are connected. The baby is still connected to the mom. We do delayed cord clamping in most all births. You know, right after the birth, she's like, oh my God, what just happened? You know, that big rush of hormones, feeling like you're on top of the world. Yeah. Slowly starts to look at the baby. Some people don't know the sex. I'm like, what do I got here? Right? So we let them discover it on their own.
Sure.
Whew. Everyone's taking pictures and enjoying and crying. Mm-hmm. We're keeping an eye on the baby to see how baby's transitioning. Mm-hmm. But we're not roughing up the baby a ton. We're not trying to get it to scream nonstop. Mm-hmm. We want a nice, gentle transition.
Right.
You know, if baby's cried once, we know those lungs are clear.
Right.
Mm-hmm. We're waiting for the cord to stop pulsating, which could be 5 minutes. Sometimes it takes 30 minutes for those cords to stop pulsating. Usually within 10 or 15 minutes after the birth, she starts contracting or cramping again, starts working on that placenta. We ask her to push with those cramps. Placenta comes out. We put it in a bowl. So baby is still connected to the placenta.
Which is that's so beautiful to look at, too. It's
I know.
Really fascinating, just like what your body does.
I just posted one of those home births on our social media.
Yes.
My mother shared her story with us. It was
so
beautiful.
Fascinating. What a woman's body does is it's just amazing.
It really is.
Yeah. Now, for those who want more wisdom about what you know, you have a podcast, don't you?
I do. The podcast.
That's why you're so good at this.
I don't know, but there's a couple of us midwives. So there's 3 or 4 regular contributors. It's called Midwifery Wisdom Podcast.
Very cool.
Its aim is for birth workers.
Okay.
So that's cool. Our aim is to spread wisdom there.
So it's a collaborative podcast.
Collaborative with the aim of the audience of birth workers.
Gotcha.
So doulas,
cool.
midwives.
That's awesome.
All people interested in birth.
Okay.
Very cool. Well, so where can they find that on?
Everywhere podcasts are.
Okay. Very cool.
On my website, midwifelove.com, on one of the back pages, I try to put all the episodes that I've contributed to.
Great. Okay. Well, definitely check that out. I'm sure you jump into a little bit more in depth and different topics. So definitely go there. If you've enjoyed this conversation today, I'm sure you spread much more wisdom there.
I try.
Well, thank you so much for being on this episode. We really hope the listeners have taken away something new that they didn't know, or just kind of hearing from your perspective too. You do this every day, hearing and feeling more encouraged if this is an option for them to pursue that. But next month, we will be having a fatherhood discussion. So you don't want to miss that. And we're going to have 2 special guests. So thank you again for tuning in. We will see you next month. And thank you for listening to the No One Told Me podcast with
Janay
and Tay.